There's a number of reasons that people have anxiety before dental appointments. One of them is, of course, patient comfort and the actual injection of anesthetic into the area that we're working on today. So today we're going to sort of demonstrate a technique that we use on all of our patients here. You'll see my assistant Roxana is placing the topical anesthetic gel on our patient here to make sure that she's numb before we get started. This is really important. A lot of people rush to put the topical gel on, and whenever they do that, it doesn't take effect. So I like to have this gel on for at least a minute or so, and so while this is sitting in place, we'll describe the additional things we're going to do. So as our patient relaxes here, you'll notice another couple things we like to do. If a patient's cool and we'd like to keep the rooms cool, we like to have a blanket down and eyewear, the sunglasses, to protect their eyes from the light, but also, of course, from anything that we're working with that we wouldn't want anything dropping into the patient's eyes. Nice clean area to work with. Prefer to use, we use a mask and gloves, obviously, every time we're working on patients. But we have several things here. This is, it's a computer-controlled anesthetic delivery device here that's going to allow me to give the anesthetic at a very, very slow pace. We always put chapstick on our patient's lips to avoid stretching during the procedure. And this is called the dental vibe. This is a vibrating wand that will be used as we're numbing our patient here to distract the tissue so that the perception of pain is not able to be felt. Now that we've waited for a few moments and our patient has a little bit of anesthetic in the area in which the anesthetic is going to be placed, my assistant, you'll notice, will be removing the topical gel. She usually kind of swipes back and forth a couple times just again to make sure to really work it into the tissue. We find it's a lot more effective when it's really massaged into the tissue gently. We always want to have good lighting whenever we're working on patients, and so we can see exactly what we're doing. You'll see the dental vibe here. It's simply whenever I push on the button, there's a vibrating that's right at the tip of the instrument. So what I like to do, if you could turn toward me just a moment, I like to rest this down in the gum area here. And so as this is vibrating, it's confusing the nerve tissue. And so the idea theoretically, and it's been proven to be accurate, is that if you vibrate for at least 10 to 15 seconds at this frequency, your nerves cannot perceive pain. And so although I am going to give an injection, I'm going to do it very, very slow. And you can see here with the tip of this, as I step on a foot pedal, you can see how slowly the anesthetic drips out. If we can drip it out at this rate, there is no way for you to feel it. In addition, we're using this vibrating technique. So in conjunction, these three things, the topical gel applying with the dental vibe, and also using the wand to slowly inject the anesthetic, allows me to give an injection, which I'm doing right now. And notice there's no reaction by the patient whatsoever. So she's able to receive the anesthetic in a comfortable way without any perception of pain. Now that topical gel that we placed on earlier, it does have a bad taste to it. And so what I like to do is, after giving the anesthetic, I stop and I continue to let the vibration occur for a few moments. As that's occurring, it's letting the anesthetic massage itself into the tissue, so that way when we give any additional anesthetic, you will not be able to feel any perception of pain. So I take this out. My assistant usually rinses away the topical gel, and that way the bad taste isn't noticeable anymore. And once our patient closes down on the suction here, I'll ask, and I want to thank her for allowing us to use her in the video. Did you feel anything today?
It was totally painless.
Well, fantastic. That's exactly what we're going for. And I hope that helps clarify one of the patient's most common anxieties when coming to the dental office is comfort from getting numb. And that's something that we really are passionate about, making as comfortable as possible for our patients. Thank you.